The views and experiences shared by guests on this podcast or video represent their individual perspectives and professional backgrounds, and may not necessarily reflect the views of the Men's ADHD Support Group. Each person's ADHD journey is unique, so all stories, information, and advice may not apply to your specific situation. These views should not be considered as a substitute for personalized medical advice, diagnosis, or treatment provided by a certified medical professional. Please make sure to consult with your doctor or mental health care provider before making any changes to your lifestyle, diet, medication, or treatment protocol. Welcome, everybody, to the Men's ADHD Support Group. We are joined today by Dr. Bill Dodson. Dr. Bill Dodson is a board-certified psychiatrist with a metric ton of experience helping people treat and manage their ADHD. We are going to do a short presentation, fairly short presentation, and we really want y'all to please respect Dr. Dodson's time. Keep your self muted, and if you have any questions, feel free to drop them in the chat, or we're going to open up the floor to do a Q&A after he gets finished with his presentation. We really want this to be much more interactive as we normally always do, and we definitely want to make sure that we are really getting into those things that you really need help with, and especially with Dr. Dodson's experience in the medical field and with adult ADHD specifically, we hope that you'll really find some value in this. All right, Dr. Dodson, I'm going to leave it up to you from here.
This was originally intended to be for people who are just getting in, who are understanding their own ADHD, what it is, what it isn't, and what's in store for them over the next year or so. Just a disclaimer, as a standard procedure for anything that we do online, it is not a substitute for your doctor-patient relationship. It should not be taken as medical advice, either to you individually or to people as a group. The views that I'm going to express here are my own and not necessarily representative of the people who are in the Men's ADHD Support Group, or especially the organizers thereof. The reasonable expectation that you should have for the outcome of the management of your ADHD is that you should be able to attain the very best version of who you already are. You should not be changed. You should not feel different. You should not have side effects. You should be the same person. It should be that your life just got a little bit easier. So let's start off with what ADHD actually is. ADHD is biological, neurological, brain-based. It is genetic. It is a part of who we are from the moment of conception. Therefore, because it's genetic and brain-based, it's going to run in families. 50% of your first-degree relatives, your grandparents, your parents, your children, your uncles and aunts, are also going to have ADHD. If one parent has ADHD, the chances of any one child having ADHD is 50-50. If both parents have ADHD, it's pretty close to 100%. This is a genetic condition. It is not, in fact, a poor parenting. And again, when the original disorder was thought of as a disorder of behavior, the parents were always the ones who got blamed for it. Because it's genetic, ADHD does not go away as you get older. You don't open up this very pretty box on your 18th birthday and say, oh, goody, that's what I always wanted, a new genetic code. You are what you are genetically. People outgrow the childhood criteria, but not the disorder itself. And so ADHD is remarkably the same, no matter what age, no matter what gender. The medications are the same, the doses are the same. We're the ones that change that. So the core features cannot be treated with behavioral modification techniques. Behavior modification doesn't fit things which are genetic, neurologic, hardwired, any more than you can overachieve with a behavioral technique. It just doesn't happen. So we need to be very clear about what the core features of ADHD are. These are the basic consistent features. They're constant. They're always there, and they make ADHD what it is. If you didn't have one of these features, you really wouldn't have ADHD. So the first one is inattention, high distractibility. It's very hard to stick with tasks. You're always going for the most recent shiny thing. Now, externally expressed hyperactivity or an internal sense in adolescents and adults of being hyper aroused. One of the questions I always ask my patients is, how many completely separate, independent lines of thought do you have going on in your mind at any given time? And even on medication, people will have at least 3 or 4. This is the type of hyperarousal that is always there, with the exception of sleep. Impulsivity. In other words, saying and doing things before you're able to think about them. And then, if you're any place other than the United States, emotional dysregulation. Again, a fancified term, which really just means a loss of control of your emotions. So the 4 features that do not refer common to very common, but non-specific features that can be found in other conditions, such as working memory, processing speed, that sort of thing. So it's basically just these 4. Emotional dysregulation may be new to you. It hasn't come to the United States yet. It started in the European Union, but it's still quite vague and non-specific. They defined emotional dysregulation as low frustration tolerance, irritability, emotional impulsivity. In other words, again, expressing emotions without thinking, anger outbursts, usually because you get blindsided by the fact that you're going to lose your temper. And people with ADHD just have very passionate lives. Their lows are lower, their highs are higher. If you look at this, this also can be found in literally any other psychiatric unit, was one of the defining characteristics. Every mood disorder or anxiety, opposition defiant disorder, you name it, it's going to have these 5 features. One of the things that has really been stumping the field for many, many years is that the treatment recommendation for multimodal treatment has been dropped. Back in the late 1990s, they did the largest, longest study of a mental disorder in children ever done. It was called the Multimodal Treatment Study of Attention Deficit Hyperactivity Disorder in Children and Adolescents, hence the MTA. And now these children are in their mid-30s, and so they're going to be followed to the day they die. And what they were really trying to answer was a simple question: what works better, medication or behavior management treatment? And there were 4 arms: medication alone, behavior treatment alone, medication plus behavior treatment, and then another group, what we call community-based treatment, were sent out into the 26 communities that contributed children to this study to see how they were really being treated in the real world. The behavior management was what they called maximum dose behavior treatment. 5 days a week for 9 months. The parents were trained in it, the kids were trained in it. So I guess it's probably a good thing that it didn't work. When they came back 3 months after it ended, they could not find evidence, even in a single child, that it had ever worked. And it did not add anything to medication management at all. So here you have this extremely expensive, extremely intensive behavioral treatment that added nothing. The people who did by far the worst were those that are in the community treatment arm, where 2/3 of the children got nothing at all. Not so much as even a pamphlet on ADHD. In order to get into the study, you had to have, and I love this scientific term, screening ADHD. So if anybody ever tells you that ADHD is overtreated or overdiagnosed, you can send them to this mammoth study. What that led to 7 years later was the American Academy of Child and Adolescent Psychiatry dropped its recommendation for multimodal therapy. There have been several other studies done in those 7 years that found exactly the same thing, that the addition of talking therapies had no effect on the symptoms of ADHD. They did have other effects, But one, they were very situation specific. That when the kid or adult walked out of the very structured environment they were in, it was like it had never occurred. So it was very situationally based. And I need to emphasize that nobody sees this as a victory. This is something that has bedeviled the field for the 15 years ever since, that we don't have coping therapies that can show effectiveness for the core symptoms. So I think the problem has always been that we weren't asking the right questions. Why did, actually, and now it's counted up to talking therapies, completely fail? They could not show, single one could not show detectable lasting benefits. Why were these things failing that everybody expected to work? And so this is a question I ask everybody who's listening to answer for yourself. Don't take my word for it. Work from your lived experience. I want you to look back over your entire life. If you've been able to get engaged and stay engaged with literally any task of your life, have you ever found anything you could not do? I'll give you a little while to think on that one. Most people, virtually everybody with ADHD, will say, no, if I can get started and if I can stay in the flow, I can do anything. Indeed, there are situations in which people with ADHD can hyper focus and not have any impairments at all. The other term you'll see out in the literature is that they are omnipotential. They quite literally can do anything if the situation's right. The first implication of this is that the theory which has dominated the field for those 20 years, executive function deficit theory, is almost completely invalid. If you're able to literally do anything, if the situation's right, you're not deficit. You're not deficit of anything. And indeed, even with executive function deficit theory, they found that only 50% of adults with ADHD had a detectable deficit. You cannot define an entire condition when after people don't have a problem. The real problem with executive function deficit theory is that they made a fundamental assumption which they never went back and questioned. And that is that people with ADHD were exactly the same as everybody else. They were neurotypical people, only they were broken or damaged. And you just had to fix their brokenness or damage by helping them learn executive function skills. They assumed that executive function deficits were the cause of ADHD rather than the result of having an ADHD nervous system and just not being able to get access to your abilities as you need them. And indeed, all the way back in 2000, executive functional weaknesses are neither necessary nor sufficient to cause all cases of ADHD. In fact, not even half of it conditions. The problem is going to be that most of the coaches that you'll be talking to were trained pretty much solely in executive function deficit theory. One of the other big reasons that therapy often fails is that no one teaches or clinicians, prescribers, know to use the medications. 93% of all adult psychiatry residencies do not mention ADHD in 4 years of training. Half of all pediatricians say that they do not feel that they are in any way competent to treat a straightforward case of ADHD. Additional therapies, and here we're talking about executive function, trying to teach people with ADHD the rules, methods, and techniques that worked great for neurotypical people who have importance-based nervous systems. These techniques do not work for people with ADHD. They don't even work a little bit. And because of this, the treatments in the past, the non-medication-based treatments, often set up people with ADHD to fail once again, just the way the school system had. So we have to think about ADHD in a totally different way. The impairments of ADHD depend on the situation. Everybody here who's listening knows that they've had extended glimpses of when they could get in the zone, get in the flow, get in the groove, whatever you want to call it, and be better than anybody. So that ADHD is actually a problem of consistently being able to assess your abilities as the situation demands. If you can do anything under the right circumstances, it's not a disorder. It's another way of being wired neurologically. ADHD, as far as I'm concerned, is a second, fully functional, perfectly well balanced nervous system, but it has its own set of rules, principles, methods, techniques, whatever you want to call them. And the other thing is the importance-based neurotypical techniques don't work at all. So how do people with an ADHD nervous system get engaged? If that's really the ticket to being able to get access to your abilities, it can solely be done in 5 ways. And I use the acronym NICA. It sounds like hiccup, and we actually field tested this and found 3 times as many people that remember NICA as any other arrangement of those letters. Novelty, we include creativity. When you're working on something creative, artistic, musical, or just out-of-the-box problem solving, you can get in the zone and be remarkable. Interest. This is probably the big one. If you're looking at the psychological literature, not the psychiatric literature, look under the word fascination rather than interest. If you look under interest, you won't find anything. Challenge or competitiveness. Urgency. Usually a clearly defined deadline, for instance. And people with ADHD use urgency the way neurotypical people use importance. It's their importance. And then finally, this is the rarest one, but it's the best one. What is it about your life that gives your life meaning and purpose? What is it that you look forward to doing every morning when you wake up? So let's really underscore the difference between a neurotypical nervous system and an ADHD neurodivergent system. So the neurotypical nervous system is the majority of the world. 90% of people out in the world, wherever you go, but it's not better in any way. It's just more frequent. As one of my friends said, they're breeders. There's more of them. And so it's the importance of the task that helps people get engaged with it and get it done. Now, they can also use the notion of there being a reward for doing the task or a consequence or punishment if you don't do it. The 5 factors that help people with ADHD, novelty, interest, challenge, urgency, and passion, are very helpful, but they are not by any means required the way they are for people with ADHD. So that gives neurotypical people some advantages. Tasks don't have to be important to the individual person. They can be important to your boss. They can be important to the teacher, to your spouse, to your parents, et cetera, et cetera. The tasks don't have to be important right now. You went to school so that you could get out of school and get a job that paid you a lot of money. So you were willing to defer classes in order to attain the goal. People with an importance-based nervous system and prioritization is nothing more than arranging things in order of importance and then being able to get started on the one that is most important. And so it is the importance of the task that helps the individual get engaged on demand, get access to their intellect and their abilities every time when they are needed, and then stay engaged all the way to the payoff. That is not the case with people who have ADHD. And it's one of the few times in life in which you can say always and never. So again, I'll ask the people who are listening to go ahead and check this out in your own life. A person with an ADHD style nervous system will be able to say, looking back over my entire life, I've always been able to do anything I wanted if I could get engaged through novelty, interest, challenge, urgency, and passion. But to my memory, I have never once been able to make use of the notion of importance. Now, I certainly know what's important and like rewards, and I don't like consequences, but to me, they are nothing more than null. They don't help me get engaged, get access to my abilities, and get things done. And so consequently, important in all the places that it's used out there by the other 90% is not a method that people with ADHD can use. So consequently, for people with ADHD, planning and organization are very difficult. If you look at any planner out there, Dave Ryan or anything like that, any schedule, it is built on two things that people with ADHD just don't do. It's built on importance and time. What do you do first, second, third, and how do you arrange those in time, and how do you judge how long each one is going to work? Consequently, organization manuals and things like that sit on the shelf, not just unused, but unusable. Now, people with ADHD, they can make it work for a little while, but it's never worth the amount of effort that it takes. People with ADHD, just as parenthetically, work best through color and deadlines, urgency. And so with my patients, I'd have 5 little folders, red, orange, yellow, green, blue, and on an index card, scrap of paper, whatever you had, something just had to be done and submitted by end of work today went in the red folder. Something that had to be finished by the end of the work week went in the orange folder. Something that had to be ready to go Monday morning was in the yellow folder, and so on. And over the weekend, everything moved forward a folder. That has a chance to work because it's color and it's not time, it's urgency and deadline. People with ADHD also don't work from the beginning to the end. All beginnings look exactly the same because the rewards look all the same. So people with ADHD actually work from the end to the beginning. That's why when we are doing individualized education plans, we would require the teacher to always show the ADHD student what an A project or an A paper looked like last time. Once they understand what the goal is, they can work backwards to know where to start. It's very hard to start when you know when all the different places you could start look the same. They all have the same lack of rewards. Rewards don't help you. So again, it's not that you can't do it, it's that you don't know where to start. Unfortunately, for people with ADHD, virtually every school I've ever seen is based not just on importance, which we'll struggle to do. It's even worse than that. It's based on secondhand importance. What does somebody else, the teacher, think is important enough to teach and important enough to put on the test because it's going to be important for you to know it in years from now? Again, a system that cannot be made to work by people with ADHD. 90% of jobs are also based on second-hand importance. What is it that someone else, your boss, thinks it's important enough to them that they're willing to pay you to do it for them? People with ADHD really struggle in such a system. Now, can they make it work? Yes, they can. But they end up having to work twice as hard for half as much. And that puts them in a real disability. So, what does an ADHD nervous system, when you get engaged? There are 3 things that make up full, and thus far I was only been doing why. What gets you in the game on a level playing field are the medications. And I personally do not care whether you take medications or not. What I do care about is that you make that decision based on personal experience. So find yourself a prescriber who knows what the hell they're doing. And that's easy to say, hard to do. And actually see what a finely tuned medication has to offer you as a unique individual, and then knowing that decide whether or not you're going to continue to take them. Don't make your decision on the basis of horror stories and biases and things like that. But that's not enough. You have to go back and you have to take those 5 factors, and those are the special ways in which people with ADHD get engaged. And you have to learn how to use those so that you can get engaged as the situation demands. And then finally, you can use therapy and coaching to go back and rebuild, repair, reverse some of the trauma that you went through trying to work in a system that was designed to make you fail. And really, now that you're a grown up, be able to right the invisible impairments of ADHD. They're not going to go away just because of taking medication. Currently, all we're doing is step 2, and we're not even doing that with. So, medications, especially the stimulants, are remarkably effective. In medicine, we measure how well things are working with a statistical calculation called effect size. And the effect size usually goes between 0.4, which is barely but consistently detectable, and 1, which is a very robust response. When you look at the first-line stimulants, methylphenidate and amphetamine, in the research studies, which are blinded and they just assign a dose randomly to an individual, you still get great results, 0.95. But if you fine-tune it, if you know exactly what medication you're doing, and you fine-tune it to that person's optimal dose, and remember that 40% of people's optimal dose is higher than the highest doses manufactured, you get a 1.8 effect size. Now, folks, that's just not found anyplace else in medicine. So what I tell people is that when they're trying stimulants and you have just good, keep going. You should have an, oh, wow, where have you been all my life level of response. In fact, better than anything else in medicine. Tamoxifen was a Strattera. In kids who are under 12, has a fair effect size. The Strattera just doesn't work well for adults. It's barely detectable. Viloxazine, which is Qelbree, which is the new one on the market, likewise, is about as effective as tamoxifen, but it's much more easily tolerated, and the effects are found much more quickly. Now, even though it's 0.62, we have to remember it's still one whole heck of a lot better than anything else we have to offer in psychiatry. The SSRI medications like Prozac and Zoloft and things like that for major depression is still only 0.5. So just about everything in ADHD is better than that. And the SSRIs for anxiety disorders, again, barely detectable. So again, with the ADHD medications, even if you end up wanting to take one of the lesser second-line, third-line medications, they're still going to be better than anything else in psychiatry. Despite how well they work, though, we're still not doing great with them, and that's because people don't end up taking them. This was a study done back in 2005, and it looks like one line, but it's actually the 3 most commonly prescribed medications: the most common amphetamine, most common methylphenidate, most common non-stimulant. Now, they thought people that were going to do it not for 12 months, but they stopped after 9 because of people never filled the prescriptions. And by the time they got out 9 months, only 13% of people were still filling prescriptions. So these medications are wonderful medications. People don't take them, or they don't continue to take them. And the fact that these lines overlap each other pretty much exactly means that this is not a factor of the medications themselves, but a factor of ADHD. That it's very hard to stick with regimens that you have to do every day, and that may be giving you side effects because they weren't finely tuned, or they may not be adequate, or whatever. But people don't continue to take the medication, and that's a presentation entirely of itself, where it's one for people who prescribe. Still, all that said, medications are the place to start. They get you in the game on a level playing field. Now, when you're first starting with dealing with ADHD, what people are going to talk about, what you came in to see the doctor about, were performance issues. How are you doing in school? How are you doing in work? How are you doing in your relationships? Performance. And so those are the things that are going to respond best to the stimulants. We have two basic classes. There's the methylphenidate class, which Ritalin seems to be the one that everybody's heard of, even though it's rarely, if ever, used anymore. Concerta is the most widely prescribed, but the generics are just a horror show, so it needs to be avoided. And then dexmethylphenidate, which is Focalin XR, which is probably the best. There's also the amphetamine class, which is where most adults end up. It's usually about 2-to-1 amphetamine to methylphenidate among adults. In my practice, I gave people a good thorough trial on both medications because in medication at the time was the one thing we had to offer that we knew worked. And so even if the first one worked well, for all I knew, the second one might work wonderfully well. And so people were given while on both, and the patient, chose which one they thought worked best for them. Now, it's important to note that 15% of people do not respond or do not tolerate either one of these medications. So that happens an awful lot. That's 1 in every 7 people are going to try both medications and not be able to take them. And that also is a presentation in and of itself. You also need to know, as you're fine-tuning the medication, that you're not going to see anything happen. You're not going to feel anything. Now, what's going to happen is it's going to be the absence of for ADHD impairments. It's you're going to be looking for things that aren't happening anymore. If you feel like you're a different person, in other words, you have the zombie syndrome, or you're having side effects that do not respond today or tomorrow, the molecule is probably not right for you, or the dose is almost certainly too high. More is not better. So, how do you fine-tune the medication? You do it on the basis of target symptoms. In other words, what symptoms do you want to target? What are the symptoms, what are the impairments of ADHD that bother you the most and that you want to get rid of today? And we can say today because the stimulant medications are immediately effective. In 1 hour, you're going to see everything that medication and dose is ever going to do. There are no late appearing side effects for these medications. Now, it's going to take time, even though medications are effective very quickly. It's still going to take time because you have to adjust the medication for 4 symptoms. Again, you have to get the right molecule, and just about everybody has a preference for one over the other. Nothing predicts that in advance. You just got to try them. You need to find the optimal delivery system that you can afford. And again, every insurance company has these as a moving target. It's which one did they get the best price on this month? And so they're going to be constantly moving. And there are many delivery systems that just don't work with them. And your clinician should know which ones those are. And it's vitally important, again, to find the right dose. Most people can tell the difference of just 2 or 3 milligrams high or low. So it's really a very important process to hone in on what the right dose is for you. And just as nothing predicts the right molecule, nothing at all predicts the dose. Not the severity of the symptoms, not age, weight, gender, nothing predicts the dose. It also doesn't run in families. You can have a parent taking a methylphenidate product, while the child takes an amphetamine product. And then the timing of doses. While they are marketed as once-a-day medications, there really aren't any delivery systems that last all the time that a person with ADHD needs them. Again, if you just look at ADHD as performance issues, you'll find people say, well, I only take it when I need it, or I only take it when I'm working, I only take it for tests, and I really don't need it other times. I would suggest that you ask your loved ones or friends whether or not that's true, whether or not you don't need medication at other times. Most people need to take 2 extended release delivery system doses in order to cover their entire working and living days. This is a real simple dose response curve. And it's going to be the dose response curve for all the medications for ADHD, even the second line medications. More is not better. What you see here is that as the stimulant dose increases, there's a nice straight line improvement up to what we call the sweet spot, the dose at which a person gets their maximum performance. And as it's going up on the left side of the curve, no side effects other than maybe a rare mild loss of appetite, which I've never had an adult complain of. If you go past that sweet spot, your benefits drop off rapidly. Then you pick up side effects. So again, if you're having side effects, well, then you've overshot that dose for you. So here's a target symptom titration. You start with what your personal target symptoms are so that you'll know what to look for as they disappear. You then adjust the medication in the smallest dosage increment that's available. For instance, that would be 10 milligrams, actually 5 milligrams dexmethylphenidate, 10 milligrams of Vyvanse, whichever one's the smallest increment that's available. So you continue to increase the dose as long as you continue to see rather significant improvement with each dosage increase and no side effects. When you raise the dose and don't see further improvement, then you've overshot your dose, and the previous dose, the lower dose, is the very lowest dose that gives you maximum benefit, and that will be your medication dose forever. Tolerance doesn't develop to the benefits of these medications. Also, you're not finished. Now, once you've found your medication dose, find a day when you can lie down after lunch and take a nap on your medication. What keeps 85% of people with ADHD awake at least 2 hours every night is the hyperactive component of ADHD. And it will respond beautifully to a dose of stimulant medication. Now, this seems entirely wacky. The people say, well, I'm taking the stimulant, therefore I should be revved up. Test it and see. Again, these medications in people who have an ADHD style nervous system have what's called the paradoxical response. People with ADHD take a stimulant, it calms them down, it slows them down. They can think one thing at a time rather than 4 or 5 things. And likewise, believe it or not, it helps people turn off their brains and bodies so they can go to sleep at night. But most people have to see it for themselves with a no-risk trial now. So what are things that respond very well to medication? Not everything does. Reading speed, comprehension, and retention responds beautifully. And you'll see this with students, but it's also just a good way for adults to see how well the medication is working. Because most adults have read maybe 1, but usually 0 books in their lives. And so being able to read a book, read a couple of pages on each dosage of medication is going to be very illustrative as to how well your distractibility is being handled by the medication. Physical fidgeting around, difficulty relaxing, being tense and impatient, interrupting other people, blurting things out, having a hard time getting started. And once you do get started, having a hard time sticking with tasks all the way to the payoff. Your mind wanders. Many people report that they're much, much less irritable, but less easily frustrated, and their flashes of temper almost completely go away, and they stop being quite so forgetful. You'll see this, and that you misplace things less frequently. Now, there are a whole bunch of things that don't, and this is a disappointment to most people. For organization, again, organization is skills and specialized skills for people with ADHD. It's not a symptom. It does not come in pill form. Well, you're not going to pick up a sense of time. As I say, most people with ADHD don't know only 2 times, now and not now. Listening to people. You're not going to be able to not drift off when talking to other people, and it's going to be hard for you to be aware of the feelings and responses of other people. Self-awareness doesn't improve very much. Self-appraisal, that ability to understand how they're doing in the moment, and also people who are already flourishing and argumentative, usually due to something like opposition defiant disorder, that doesn't get better either. So how do you know when the dose is optimal? It's when you increase the dose and things don't get better. The previous dose was your optimal dose. If you want something very objective and a number you can use a second number in your blood pressure. You take a blood pressure before you take the medication, and then at least 90 minutes after you've taken the medication. And as long as you're on the left side of that curve, below your optimal dose, your diastolic blood pressure will not change. You go towards the right side of the curve, and the second number of the blood pressure will pump up at least 10 points. It's a canary in the mine shaft. You'll see the number of your blood pressure pop up before you have any side effects. And again, most of the problems, most of the treatment failures come because of people's erroneous expectations. The most common one is people expect to feel something. These are stimulants, therefore I should feel stimulated. And so they end up overshooting their optimal dose. They forfeit much of the benefits of the medication and then have rather unpleasant side effects. The side effects, if I do get tolerant to them after about a month, and the person says, oh, the medication stopped working, but gee, doc, I doubled my dose and I feel it working again. And so what happens is, because people are looking for something to happen, they end up overdosing themselves and sabotaging their treatment. At the optimal dose, you should perform, again, this is a performance thing, at the same level as a neurotypical person without side effects. In other words, you're going to be able to pay attention, control your impulses, control your emotions exactly as well as a neurotypical person, no better, but also no worse. You've got a fair shot for the first time in your life. But you should still feel the same person that you always were. You shouldn't feel different. It should seem like your life is just a whole bunch easier. The stimulants are great for performance issues, and with being able to control the highs and lows. It doesn't actually come along with having an ADHD nervous system. But they are not particularly good for rejection sensitivity dysphoria. For those, we use two other medications in the alpha-2A agonist. These were originally brought on the market back in 1963, way back. As blood pressure medications, it didn't work very well. But in 1990, they got approved by the FDA for the treatment of ADHD because they help with all the other things not having to do with performance. It helps with impulsivity, it helps with sleep, it helps with the inability to relax, and it helps with rejection sensitivity dysphoria. Each one, though, each molecule, however, has a disappointingly low robust response rate. Only about 1 out of 3 people will get that, oh, wow, life-changing level of response to an alpha-2 agonist. But it's a different 33%. So if the first one doesn't work magnificently well, try the other one. So that if you end up having to try both of them together, there's a chance of about a 60% very robust, life-changing level of benefits. So let's say you got your medications right. Perfectly fine to the stimulant, and you've also found that an alpha agonist can change the quality of life like nothing else. What do you do then? What most people do is they start with a good food. Because again, you have to learn your nervous system and the fact that it is totally different from the other 90% of people. Also, well, This is a fruit that many people have that we might as well dash right away, and that is you are never going to be neurotypical. The neurotypical techniques that you have devoted your life to thus far to try and make them work will not work, no matter how long you try them. They just don't work well. I mean, you may get them to work for a very short period of time, but it's never worth the effort. You were given the wrong owner's manual for your nervous system back in preschool. And all the techniques that you see working very well for the other 90% don't work for you. And you assumed that it was something wrong with you rather than with the owner's manual, that you were set up to fail. Coaching focuses instead on what goes right. Those times when you do get in the zone and can be omnipotential. So a lot of what coaching is learning how to get in the zone. And for that, you need a new owner's manual. I wish, in fact, we tried, can have a one-size-fits-all owner's manual, and people are just way too different. And, the techniques tend to follow a pattern for a while, you have to stop using them until they're fresh again and use something else. But you have to be aware of those times when you come out of being in the zone or being in a hyper focus, and you say to yourself, wow, I just got 3 or 4 hours worth of work done in about 30 minutes. You stop right then and there and you say, how did I get in the zone? How did I become superhuman? And which one of those 5 things was it? Was it because I was working for novelty and problem solving? Was it because I was interested or fascinated by what I was doing? Was it because it was challenged? Was it because it was urgent? Or was it something that I was passionate about? Write it down immediately. Do not kid yourself. You're going to remember to write it down later. That has never happened in the history of the world. So this means that you have got to carry around with you a pad of paper and something to write with, to write yourself detailed notes about how you got in the zone. I suggest that people carry around an index card because most people are going to ultimately need about 60, maybe as many as 100 different techniques that work for them that you can rotate as one stops working, you can rotate a new one. So that the next time that you're faced with a very important but mind-numbingly boring task, you can say, okay, technique number 26 worked last time. I'm going to use technique 26, get engaged with it, knock it out, and go for it. You also will need to learn to do those things because a part of ADHD, very commonly, not always, but a part of ADHD that the medications really just don't help. Lack of a sense of time, people are stuck in the now, and they have a hard time learning from experience. They are only aware of what they're thinking and doing right now. They find it very difficult to look even moments into the future and see the inescapable consequences of what they're about to do, but they can't see it because they're stuck in the now, and they're not able to look into the past, find similar situations and what worked and didn't work in the past. There's also a relative difficulty with self-appraisal. Many people with ADHD find it very difficult in the moment to be able to look at themselves and figure out, how am I doing? What effect am I having on the people that I'm talking to? Have I bored them? Have they wandered off? That sort of thing. Because self-appraisal is part of social learning. We do things, we see what benefits or problems they cause, and we learn what works and what doesn't. If we can't appraise how we're doing, then we don't learn socially. And this is why so many kids have trouble making and keeping friends, is that feedback loop is broken. There's some people who are experimenting with videotaping. So that when things happen, people can actually play back the tape and literally see themselves as other people see them. One of the most important things people learn to do is to lead a life in balance, that they don't get to the point where they're just all used up. Their coping abilities are completely exhausted, and they are very easily overwhelmed. They need to recognize, again, that self-appraisal again. They need to recognize when things are about to get hairy and remove themselves from the situation until they can recharge their batteries. They also have to learn how to do tasks that benefit other people. In other words, they're not interesting to them as a person. They're not problem solving, whatever. These are things which are important to your girlfriend, to your spouse. And really what it takes is the development of a sense of pride in yourself, that you're a good father, you're a good husband, you're a good employee. And lastly, learning to be a good active listener to other people. Once you've mastered yourself, you have to learn how to get along with other people. Therapy. Leading a life with untreated ADHD is terribly hard, to the point of being traumatic. There's a wonderful article by Michael Jelenic shows that the average elementary school age child, by the time they are 10 years old, has heard 20,000 additional negative or corrective messages in the school alone. So this doesn't count the stuff they've heard at home, on sports teams, from friends, from kids on the playground, etc. People with ADHD are constantly being bombarded with negativity about who they are and the message that I don't like you the way you are, and you'd better change in a hurry. But they don't tell you how to do that, and they basically just end up with you being emotionally beaten up. 70% of elementary age school children do not have a best friend. And that's because, again, they don't have the social skills and developmental maturity. Also, people with ADHD don't have confidence in themselves. They know they've got tremendous abilities because they see extended glimpses of it, but they're never sure that it's going to show up the next time they need it. And it usually doesn't. So you're not sure of yourself. You're not sure that you've been discovered. And finally, people with ADHD, on one level or another, know that they don't fit in the neurotypical world. They know that they are different. They've always been different. And they basically are trying to fake it in the neurotypical world. And so they always feel as if they're a human monster who doesn't really belong there. All of these things are things which happen to us. They're not biologic. They're not genetic. This comes from life experiences. And so consequently, no medication is going to help you with this. Working with a coach, working with a therapist who is trauma-informed and what you're going to be looking for. And go back and you decide who you are, who you want to be, and what you're worth in the world, and not let other people who didn't see as a kid or that final say. So one of the outcomes for this is to go back and view yourself as an adult, viewing yourself as a child, and being able to treat yourself with compassion for all that you went through. Now, most people with ADHD find themselves as being their own worst critic. They criticize themselves, they put themselves down before somebody else has the chance to do so. Accept yourself for who you've always been, who you are now. Also, you can develop pride because you became the successful person that you are right now with little or no help. Your parents didn't want to, but didn't know how to help you. Again, these things about how to work an ADHD nervous system are brand new. They're yet to come out in book format. But once you've done this, it will help you learn to be the parent of your children, the type of parent that you always wanted and never had, so that your kids don't have to go through what you went through. That's the overview of what people with ADHD need to do in order to fully recover and control their lives. Thank you for listening.
Thank you very much for presenting that, sir. I know I actually I learned a couple of things, and even me and you going over this, I forgot one of the slides, and it really drew it to me. Was just like how much I had to learn from therapy to recognize what my medication was actually helping me with. And I think that was one of those things that, like, because that's also how I found I had autistic tendencies, was therapy started going through, and we found all those little things that I was struggling the most with, like social interactions and communicating and stuff like that. And then my therapist going, your medication's not going to help you with that. That's not what it's supposed to do. And I'm like, but the medication is supposed to help me do all these things. No, let's talk about that.
Doesn't do everything,
Yeah.
but you need all three pieces.
Yeah. So for all those out there, does anybody have any questions? Please use the reaction button at the bottom. It has a little raise your hand feature. We do have some questions that that have been submitted to the group, but
41.
And all right, and starting with Steve.
Yeah, I have a million questions, and I'm not going to ask every one of them, and I'll take my turn coming around. But starting off with the symptoms and how they're managed by the first line medic one, and like that balancing with side effects. First, I'm just curious, like, why are we just using the diastolic heart rate and could you also use? I'm asking from personal experience. My heart rate elevates when my dose is too high, which is a negative symptom for me. And the sort of question that goes along with that is, so what happens when our symptoms, and I understand the difference between symptoms and skills, but if our symptoms haven't improved quite enough when the side effects start kicking in?
Okay.
Multiple questions that I tried to
Multiple questions.
get to one.
Okay. Let me tell you about the life of a mental health professional. We make judgment calls one after another the whole damn day. This is one judgment call after another, one educated guess. So when we have a number like the diastolic blood pressure, it really means something, that measures something that's important. We're going to use that every time. And it turns out that the second number in the blood pressure is by far the most accurate, the most reflective of the dose being too high, that it's not affected by other things. Heart rate going up is going to be affected by caffeine. So caffeine's a stimulant, but it doesn't affect the diastolic pressure until you've had way, way too much. And so it's an objective measure of whether or not the dose is too high. It's something you can count on. But as you point out, it can be clouded by having much caffeine on board. And a lot of people find they have to go decaf because they've been treating their ADHD with quality for decades. Also, again, I'd like to emphasize that what the first line stimulants really help with is performance issues, becoming much more efficient, not being distracting, being able to get started when you want to, that sort of thing. But they don't handle other aspects of the condition. They don't handle the impulsive or the hyperarousal components of ADHD. So that most people will still fall asleep at night. And they're taking all sorts of things. And the biggest problem is they use marijuana to go to sleep at night. And that's how they get introduced to daily use of marijuana, which means their ADHD is pretty impaired the next day. So for that, we use the alpha agonists because they help with hyperarousal, sleep initiation, rejection sensitivity. They handle all the stuff that the stimulants don't. So if you're in that lucky 60% of people for whom the alpha agonists work, most people end up taking both medications. And many people say the alpha agonists, just in terms of my quality of life, the alpha agonists make more difference than the stimulant does. But again, most people don't know to use them.
Yeah, that was actually one of the things that I had to learn later on was yes, the ADHD medications helped me with my emotional dysregulation, but I still had all that rejection feeling and the imposter syndrome, and that was whenever they started me on a mood stabilizer, and that was really beneficial. Brendan, you had a question?
And we might have just answered it, but ADHD rarely travels alone, right? And I was listening to the like meds, ADHD stimulant meds, we want to often go high. But anxiety and ADHD are best friends because anxiety is best friends with all of the mental health challenges that we have. And stimulant meds can, as far as I know, up your anxiety. I've experienced that because yay, generic Concerta. How do you navigate that component? Like, how do you? Is that we just don't do the stimulant meds and go to something else instead? Is there a point like can you go high enough on a stimulant meds that somehow you're not increasing the anxiety? Like, what does that look like?
Most of the things we think we know about the ADHD medications turns out to be wrong. So
Okay.
that when they actually look, everybody thought, oh, if you give stimulants to people with anxiety disorders, the anxiety disorders are going to get much worse. Well, they've done 26 studies, which is a lot. And what they found was that for 80% of people, their anxiety got better. 10%, it stayed the same. About 10%, it got slightly worse, not a lot worse. And so that's one of the things that gives me a chance to go back and harp on is the importance of not using a milligram of stimulant medication more than you need to. And so that's where you can use the diastolic blood pressure to help you really gauge. I'm using maybe 2 or 3 milligrams too much. Thank you also for mentioning that the generic Concertas are just god awful. Don't use it.
Yeah, that ruined me that's why I'm not a teacher anymore.
Yeah.
There's a long story to that. Second thing is make sure that you're actually being able to treat anxiety. First thing I ask people, I say, Doc, I'm so anxious. I ask, tell me more about your baseless apprehensive fear, which is the definition of anxiety. For no reason, I feel as if something awful is about to happen. I can tell you 9 times out of 10, people look at me with a quizzical look and say, I didn't say I was afraid. I said, now let's not use the word anxiety. Tell me what you experience. And usually what those guys will, I'm constantly going, I can never relax. I'm always at efficiency. I can't turn off my brain to go to bed at night. Oh, what you're talking about is the hyperactive component of ADHD. Or I'm constantly worried that I'm going to be rejected by somebody. And I'm afraid to go to social situations. Oh, so what you're really talking about is not anxiety, but rejection sensitivity. So never go with the first word they use. Make sure that you're actually dealing with anxiety. Third thing, I'll shut up, Shane. And that is, we don't have good medications for anxiety. We just don't. It has stumped us. The SSRIs don't work with the hood. Benzodiazepines have their own problems. Like Lipramine and tricyclics are almost intolerable. Useful really doesn't work. So what you really need is a good cognitive behavioral therapist to help you deal with anxiety. Medications don't do it.
So the next question that we have is for Remy. Go ahead.
Just want to mute myself there. Thank you so much for doing this, and hopefully this isn't too broad a question, but how do you come to terms with severe career burnout that is caused by undiagnosed ADHD mixed with the kind of part 2 of wanting a career transition or trying to make a career transition, knowing that many of the classic ADHD symptoms make both of those things significantly harder?
Well, level the playing field. One of the reasons why you've burned out is you're having to work twice as hard as everybody else for that as much. Because ADHD, its first manifestation is inefficiency. Also, you're trying to make things work, they will not work. There's no faster way to burn out then it could be hopeless. That I'm throwing everything I've got at this and not getting anywhere. So the first thing I'll do is I would maximize, optimize everything I can do to get in a level playing field. Then I would use ACT therapy, acceptance and commitment therapy. There's a manual out there by Stephen Hayes called How to Get Out of Your Mind and Into Your Life. Because people with ADHD tend to try to think everything right. And what I tell people to do is let's start with chapter 1, start with chapter 11, 12, and 13. And it's a process, and it's better if you do it with somebody else, of writing your own obituary. What is it about your life that in the end really made? So go ahead, write your obituary, then go back and tear it down, tear it down, tear it down. The thing really matter to you, that you really care about. And that's that fifth way of being able to get into the zone. Lead your life of meaning, purpose, and intention. It's rare, because most people, that's a hard thing to do. But if somebody is burned out, that, whether you have ADHD or not, finding life's work, finding people to lead their life with, mean something to you, care about, is the cure. So that's the best book I've found.
Yeah, I shared a link to the book in the chat section below. And Remy, I'm going to kind of hop on this one as well. A big part of coaching, like Dr. Dodson said earlier, is about creating your owner's manual and finding those things, finding those passions and those values that you hold dearly and those strengths that you have, and using those to either mitigate the weaknesses that you have or delegate those things that you don't like doing, or even eliminating a lot of the big concerns out of your life that you don't have any control over.
I'm going to piggyback on that for a second, Shane, because Dr. Dodson also sort of like mentioned and then moved quickly past acceptance and commitment therapy. And that's great stuff, right? And I kind of play with it. I play with it a little bit differently. I just use a different language a little bit. I like to talk about permission, right? Because I'm often talking to other people. And they sometimes acceptance, you sometimes need someone else to be like, no, you're allowed, like, and then you can accept it. So one thing that we as folks with ADHD is we need to be allowed to have ADHD. That's how the way we get to accept that we have ADHD is to give ourselves permission to have ADHD. And if that hasn't drifted through your heads yet, like, you're allowed to have ADHD. That's been a theme of what Dr. Dodson's been saying without it actually being pulled out. So I'm just going to pull it out real quick. That's really important stuff.
Also, give yourself credit for all the work you've done. Most people with ADHD don't give themselves credit. This set of slides was pulled out of a much longer presentation called the 6 questions we should have been asking. And one of them, question number 4, and everybody, you can go ahead and answer this for yourself. Again, look back over your life. Where did you learn what you know? What you know about the job that you're in, what you know about living, what you know about being a good friend and companion to other people, how to lead a good life. Where, from whom did you learn all those things? What most people with ADHD will say, and we'll hear about like 99%, will say, what I know, I taught myself. It'll be some version of that. I see people nodding. What I know, I taught myself. Now, in school, I'd sit in class, I'd listen, but I'd have to take the book and my notes back to my room, take it apart, learn it my way, and then put it back together in a neurotypical way, started putting it on the test. Or I'd see somebody who likes something I really liked, and so I looked to see what it was, or analyzed it, and I made that a part of my life. But you got to where you are because of you. All the good stuff you did probably on your own. You are extremely lucky if you are what we call a cheerleader or an advocate. somebody who didn't let you go through the ADHD alone. For example, as a parent, a grandparent, a special teacher or something like that. You're very lucky if you ever had that. So just a quick digression.
Yeah, I found that lesson out way too late. I tried to go to college, spent way too much money on that, and everything in college I was learning, I was like, I either already know this or it's completely useless for me. And I was like, okay, I'm just gonna go learn everything from YouTube and Khan Academy and a lot of those like different Montessori education programs. And that was honestly just like really focusing on what my strengths were, which is for me, it's been
And
always
for
been
instance,
reading. Yeah. So Gary, what question do you have, boss?
Yeah. Well, number one, I just want to say thank you for having this. And, I really appreciate especially the fact that it's a bunch of men getting vulnerable and talking about the shit that we don't like to, we probably have been conditioned not to talk about to others. But I fall victim to, even though I'm very aware of it, and I really try and not fall victim to it. But there's so many social media Instagram ads and all that are just so predatory, specifically about apps and then supplements that that are supposed to help with the miracle cure or whatever for ADHD. And my gut feeling is probably all of them are bullshit. But I just wondered, Dr. Dodson, since you're an authority, are there any apps or any supplements that, and specifically the supplements that are supposed to enhance or help balance out stimulants?
as you can imagine, if you had these wonderings, you had these questions, other people had them as well. And these things have been thoroughly researched. There was one that was done by the Office of Technology Assessment, which is an extension of Congress of all things. And again, they want to know what works before they put federal dollars behind it. And so they looked at very well done, double-blind controlled studies, and they could find no evidence whatsoever that what we eat had any effect for either causing ADHD, making it better, making it worse. No detectable benefit in more than 60 studies. These things that you see advertised, focus factor and stuff like that, they're letting you pay $40 for a bottle of vitamins. None of that stuff works. And these things like neurofeedback retraining, there is never once in 35 years been a blinded study that shows that it does anything at all. PubMed from Norway has great following. There was meta-analysis of all the studies of CogMed, and again, they can find no evidence, not a shred of evidence that it had any benefit whatsoever. So, basically, I'm a simple guy. I just want to know what works. And none of us, if they're being out there and they're wanting to sell you something on the internet, beware.
Yeah. This is one of those things that you have to be really cautious with. And you had mentioned apps and stuff like that. I think the one app that I know of is Inflow. They do a fairly decent job with their programs and everything like that. But it is a lot of self-learning. So if you have an issue with that, but they do a good job providing videos, providing written stuff, providing audio stuff that you can just listen to. So I will say Inflow is one of my big go-tos. And honestly, Motion AI, while horrifyingly expensive, is a good color-coded general productivity assistant that really does help people. But again, it's very expensive.
And something you can do on your own.
Yeah, and it is something that you can do on your own.
Like that was his owner's manual business.
Mm-hmm.
You're the expert on you. You're the one who's there. So it's when you find something that works, keep doing it.
Yeah.
Apps are made for everybody. That's sort of a one size fits all. You do what works for you. That's why we found we couldn't do the one size fits all owner's manual. People were just fantastically varied.
All right.
So that's what we're going to be talking about next week.
Yep. We've got a few more minutes. Dr. Dodson, are you okay if we go a little bit over to make sure everybody gets their questions asked? Okay, sure. Excellent. Thank you so much. Michael, you have a question?
First of all, thank you.
Thank you so much for this excellent presentation. Yeah, just really thought provoking and really helpful with some of the statistics you shared in terms of like, what you were saying in terms of how there's really no way to predict what's the effective dose of like, of an ADHD medication. I think particularly stimulants you were referring to. And then the other one that really caught my attention was the maximum FDA recommended dose, quote unquote, is inadequate for like up to 40% of people. Were you just talking about stimulants or in general?
Stimulants.
Stimulants. Because I myself am on Vyvanse 70, which is the max dose, and it's not adequate for me. I'm not experiencing any significant side effects. So from a very practical standpoint, I'm curious about what barriers patients come across when they're in a similar situation and they need to go to a higher dose in terms of getting covered for a higher dose, cost, those sorts of things, just from a practicality standpoint.
Like 10 years ago, the insurance companies would bring us to a bloody mess before they would put two extended release doses. They just would not do it ever. Now, unless they're fly-by-night organizations, will cover two extended release doses because it's just so commonly done now. Because now the standard is that you medicate at all times, places and situations in which there's impairment. And so, while people may be impaired at school or work, they still have to take care of a family. They still have to drive a car safely. They still have to work with their kids and be a good parent. And they have to go to sleep at night. And the vast majority of people with ADHD can't turn their brains and bodies off to go to sleep. So you can get 2 doses now.
Okay.
The whole notion of maximum dose is a misunderstanding. When the FDA said maximum dose, they mean that was the maximum dose that they looked at and approved. So imagine that you're a drug company, you spent $2 billion, billion with a B, getting your product up to the stage 3 study. And all you have to show in the stage 3 study is safety and efficacy. How are you going to design that study? You're going to make sure the dose is high enough that you see the benefits, but also low enough that there's not a chance in the world of a side effect or an adverse event that's going to keep your product from getting to market and getting that $2 billion back. So if you look at the doses of every medication in medicine, not just ADHD medication, they're grossly low. Because that's how they had to do the stage 3 study. Also, just as a little fun fact to know and tell, somewhere between 6 to 8% of people optimize the doses of stimulants lower than the lowest dose made. They start at 10 milligrams of Vyvanse, which is the lowest dose made, and they're already having side effects. You go down on the dose. And Vyvanse is the only medication that you can dissolve in water and it doesn't decompose. So it's particularly easy by lower doses of Vyvanse. But if somebody starts off from the first dose having side effects, they're most likely a low dose responder.
Bill, you had a question.
Well, I was trying to lower my hand back down because I really want to acknowledge this talk about the passion. I'm 80, and when I first started trying to get some help, I was going to a psychiatric nurse practitioner, and he didn't think that I could have ADHD at all, and have lived 80 years without recognizing it. And what I realized, and now for the last 2 years, I've been in therapy, and because I have a lot of baggage on top of this, I'm working through it at the same time. But I realized that really my passion got me through the first 40 years of life without a lot of problems. And so finally, and yesterday, and as soon as it's off, I'm going to be writing about what I've learned, and just came up with last year about what direction I want to make when I grow up. And so I think that knowing your passion and direction, for everybody who's been stranded, you don't have ADHD, is a critical thing that they need to be looking at. And that's really all I have to say.
Yeah, absolutely, guys. Passion is it. Like Bill said, actually, both Bill
And you
said.
don't go looking for it. It's not going to come find you.
Yeah. And look, a lot of y'all are going to have to really understand that your passions are going to be fucking niche as fuck. Like, I just want to be really blunt on that one. Sorry. But, like, I know a guy, and y'all know him in the group. His name is Steven Glazer. His profession is taking pictures of pugs. He's a professional photographer, published throughout the world. His niche is pugs. So you have to really explore your passions and to find those really interesting things that like really drive you into it. Because then you can actually find the links between all those different things, and you can kind of find an overall thing that you can kind of cycle through, so that you don't get burned out and bored with stuff. And you'll see this in your hobbies. Bill?
Yeah, I'd like to offer another way of getting started in that. In our practice, for people who are under the age of, we would do the ACT workbook and stuff like that. But usually people under the age of 26 didn't have enough life experience yet to know what really mattered. They need to go out and try more things. And so for them, we used a shorthand way. Rather than asking people, what do you desire? We ask them, what do you regret? And so we would ask people to close their eyes, clear their mind as much as a person with ADHD can. And then when they were ready, well, imagine that they're now 80 years old, sitting on a front seat, walking through a lifelong frame, and they start the following sentence. You know, knowing all that I know now at the end of my life, if I were to have led my life without a single regret, I wish back in January of 2024, I had, and you finish the sentence. Most people don't know what they desire, but just about everybody knows what they regret. And so regret can be a huge motivator until a better one comes along. And for younger people, it's sometimes the only one you got. So that's quick and simple.
Boy,
and you can do it over and over again.
Yeah, that's getting clipped. Oh man, that's a good one right there. Because I could look back, like, man, I really wish I had played bass guitar. Judge, you had a question?
Yeah, first of all, Dr. Dodson, I want to appreciate everything you're doing for this. As a therapist, a couple different things. As far as what to tell a patient, or even for myself, is there pinpointed information that's easy for people to understand as far as when they're asking a psychiatrist to speak with them about the right medication, the right dosage, what to be able to say to find out? Because I know people with ADHD are going to need to be able to know bullet points, especially myself. And also as far as extended release medication, because I'm on Jornay, is there a difference to be able to notice the difference as far as the effectiveness with that as compared to, let's say, something like Adderall or something that doesn't have as pure peaks and valleys?
Jornay is a great product, a new product, one that you still have to fight insurance companies to give you, but there are coupons that get you at least the first 3 months for free, so let you try it. Jornay is a product you take at night, and it doesn't become bioavailable until the next morning, so that you wake up on a dose. And then it does last about 11 to 13 hours, so it gets you through most of the next day, so it's a very good product. One of the ways I ask people to know whether or not the medication is good enough is I ask them a simple question. I want you to rate your medication on a scale of 1 to 10, with 1 being just god awful, nothing but side effects, and 10 being the very best you can imagine a medication being. What number would you rate your medication? Of course, we're looking for an 8, 9, 10, something like that. 7 is about the lowest that we'll accept, because we know that anybody who says 6, from experience, we know we can get a better outcome. We need to look further. So before somebody stops, again, that's that oh wow level of response. We want something in the 8, 9, 10 level, and we don't stop until we get that.
What was the name of that product again?
Jornay, JORNAYEM.
Jornay.
Yeah, I
It's,
take
it's
that
a that's
medication.
a Finidate delivery system. It's an excellent product.
Yeah,
Alright.
Journey PM. But you probably are going to have to get, I know with my insurance originally they covered it, but then they probably would need prior authorization from your doctor to be able to get that medication.
Now,
So,
your doctor has to jump through hoops. And so basically, when I had to do that, I just cut it short and went back to my Jesuit training that it's okay to lie to evil. So I was just telling the patient has already tried 4 different products, didn't tolerate any of them, and I'd like to try this 5th one. And they tried it with a doctor before me, so I don't know the records. Because what they want to see is the cheap stuff has been tried and failed. So just remember what the good Jesuit brothers have taught us. It's
Yeah.
okay to lie to evil.
Yeah, and so just make sure you're finding a doctor who, like Dr. Dodson talked about this in his thing, find a psychiatrist who gets it, who understands ADHD, and work with them. And if anybody's really pushing back on you on what you're asking for, find another doctor.
Yeah.
You know, it's the same thing for therapy or coaching. If you're not getting the support and help that you need,
Keep looking.
yeah. And that may take time, and that sucks. But I mean, I went through 4 different psychiatrists before I found one who actually believed me.
Again, that's ADA meetings are good for. They can, or Chad or whoever. These are people who are just a year ahead of you, and they know who in your locale is good and who's not. Don't waste your time with them. But they can save you an awful lot of looking by telling you who gets it, who's accepting, who's not going to embarrass you, that sort of thing. Also, groups like this, if you can find somebody who lives in your part of the country.
Yeah, we get a lot of questions like that. Hey, I live in Alberta, Canada. Anybody know a good doctor in my area? Or, you know, and so like that's what the group is for. So, one last, does anybody have any questions before we wrap up? All right, going once, going twice. All right, this has been excellent, Dr. Dodson. I really appreciate it.
Great.
For all of you out there who were able to make it, we really appreciate it. We will be sending a video with all of this out later on down the road. The video link for it, it'll be on YouTube. And we just really appreciate all of the support that you've been giving us and donations and different things like that. We really appreciate Dr. Dodson allowing us to make this a donation-based event. And we really want all of you to, if you can, check out next week's. If you can't, because of time or something like that, we will send out a video on that as well to everybody who signed up for any of them. And of course, check out our YouTube for the initial interview that we did a few weeks ago before Christmas. It's pretty enlightening as well. So again, thank you, everybody. We really appreciate it, and y'all have a good night.